Good morning. You're watching the morning news show right here on CNN News 18. My name is Toya Singh. Through the next hour, we're going to be walking you through all of the country's top news stories. Let's take you to our first story. A update coming in from our neighboring nation of China. The World Health Organization officially seeking a detailed report from the nation on an increase in respiratory illnesses and cases of pneumonia in children. This move came after media reports that Chinese hospitals have been overwhelmed with sick children in two regions in particular, one of which is the capital, Beijing. This is as an outbreak of pneumonia escalates in cities across the country. And this is as the country continues to grapple, remember, with the aftermath of COVID. Still, this is the World Health Organization. They asked Chinese authorities of this. Now, these are the updates we have so far. We'll wait for a reporter to join us to bring us more details. But it is reported also that China has responded to it. We'll share China's response in just a second with you. We'll also bring you more details. Remember, China has been dealing with this, what they've called a mysterious pneumonia outbreak that's spread particularly in Chinese schools, as we've told you, resulting in hospitals being overwhelmed with sick children. Now, my colleague Shireen is with us right now to bring us more details. Shireen, I believe no deaths had been reported so far as of just till yesterday. So multiple cases, but no deaths so far. And I believe Chinese authorities are now telling the World Health Organization that even when they're doing the inquiry, there are no pathogens they don't recognize. Can you tell us, Shireen, A, what is a pathogen, and then tell us more about the Chinese statement, please?
Well, as far as the cases of pneumonia among kids in China is concerned, it started around mid-October. And till now, there has in fact been hundreds of kids who have in fact been affected by pneumonia. Now, remember what the Chinese government in their statement, the medical department in their statement have been saying is that because the restrictions of COVID-19 has been removed, more and more people are going out, children are going to school, and that is why these unidentifiable cases of pathogen is coming out in the open. There are illness of respiratory illness that is eventually, turning into pneumonia is the cases that are being found in children. Now, so far, the WHO has raised a concern and they have also sought a report from the Chinese government as to what is really happening on ground and what are the steps that they are going to take. Now, apart from that, WHO themselves have also given, in fact, a series of advisories that includes wearing masks when necessary, ensure that when they are sick, if the children are sick, they stay at home and not meeting with people who have any sort of illness. These are some of the points that has been put forth by WHO. They have sought a report from China because remember, this is not a normal case because we are seeing hundreds of kids that are getting pneumonia, that are being admitted in hospitals, and hospitals on the other side are overwhelmed with these many cases that are coming at this point. Now, the Chinese government, of course...
Can I just ask you to stay with us? We have Dr. Sanjeev Bagai, an Indian pediatrician and nephrologist who's with us this morning to bring us more details on this entire story. Dr. Bagai, good morning. Thank you for joining us here on the show. Dr. Bagai, if I may ask you, I assume you've been looking at the reports that are coming out of China right now. China's just told the World Health Organization that there are no unrecognizable pathogens in this spreading, this pneumonia that they're calling. What does that mean? Can you just break down to our audiences? And the reports coming out of China, do they strike you as a cause for worry or not, sir?
Yeah, so China is always a cause of worry. What is available in public domain is these are viral pneumonias or bacterial pneumonias, we are not sure. There are nodular lesions in the chest. There are reports of respiratory syncytial virus, influenza, or mycoplasma pneumonia. Now, these are highly transmissible and airborne diseases. It can go from close contact person to person through fomites and various other modes of transmission, human to human transmission. It's more rapidly progressive, especially pathogenic in smaller children and school-going children and infants. So far, I think we've got no concise data or cause or etiology as far as China is concerned. My only concern is that there may be another cover-up, much like they did in COVID, of concealing and misleading facts and then ultimately misinformation. So I think WHO needs to go into overdrive, send the team there, get the samples analyzed, do the serology, and let the world know what is happening. If a child has it in an index family, there is what we call as household transmission. Adults can get it. there is free flow of international traffic and travel, this may actually exit the boundaries of China very, very soon and go into other Southeast Asian countries and indeed into Asia and Europe and elsewhere. So I think we need a very, very firm control on this. And I think WHO needs to be a lot more stricter, sterner, and a lot more proactive than what they did in the early part of COVID.
Can I also ask you, sir, one of the sort of unfortunate byproducts of COVID is that we've heard of multiple cases of quote-unquote mysterious illnesses that have taken place across the world. To some degree, we've almost become averse. We hear the story and it's a story we've almost become used to. When you come to know stories like this, how do you know which are the stories to pay attention to? Which are the ones where there are red flags? For example, this one where you're saying there is a cause for concern.
Yeah, so I think any outbreak, be it an initial epidemic of whatever magnitude, small, medium, or large, I think needs a very careful attention. We've learned, and then through the hard way, through COVID, that we didn't pay adequate attention to what China was doing. And then the infection spread very, very rapidly. Within a couple of months, it had reached Italy, Europe, Southeast Asia, and then rest of the world. So anything which is airborne, any viral or bacterial infection which has human-to-human transmission or household contact transmission needs very, very aggressive attention. The other concern is we don't know what the impact of the immune status is after the prolonged zero COVID lockdown. And I'm sure there will be a lot of variations and a lot of mutations in a host of viruses because the society at large has not been exposed to develop what we call as the natural immunity. So there are a lot of factors to be considered from an immunological point of view, but I think this is a red flag. We need to be cautious. We cannot believe what China says. That we've learned through the hard way. And I would request that WHO sends its team immediately and gets an unbiased report within a week or so.
Okay, can I ask you one last question, sir? One of the things you talked about a little earlier was that the World Health Organization was not as proactive when COVID took place. If we were to assume the organization may act similarly in this case too, sir, what can India do, especially because in some ways we have porous borders in the sense that travel takes place China to India, India to China every day. You have flights going, for example. Is there more at this moment India can do, or would it be too early?
I think we need to start just looking out for early signs. If the infection is still localized in China, the real worry is that no one believes what China says. So the real impact is that especially in international traffic, we then, for any passenger who's been to China or recently, at least in the past 2 weeks, would have to be screened in exit and entry. That puts a huge manpower and financial resource burden on the parent country and the neighboring countries. So I think we need to be very, very careful. India is a very strong representation in WHO, and I would request the Indian government to put adequate pressure on WHO to screen what is happening there, to get the serology and put it in public domain. No one is safe till everyone is safe. And I think China can't play hide and seek like they did last time.
Okay, can I ask you a last question, sir? One of the slightly tricky issues, at least with COVID, was the difficulty in scanning it. You had, obviously, you had instruments that could measure temperature, for example, when people were coming through immigration. That was one step that could be done. But I just want to ask you, sir, we've essentially had 3 years, 2+ years of dealing with COVID. Over the years, have you seen a development in the kind of instruments? Do you see better technology now that could be used in this case, for example?
I think surely. I think India has been a case example as a beacon of light as far as improving healthcare infrastructure and screening and protocols are concerned. But the difficulty with this present outbreak as an epidemic, even though it's localized in certain zones in China, is that we are not sure of which organism. There are reports of influenza. Influenza itself is of various subtypes. There are reports of respiratory syncytial virus, of mycoplasma pneumonia, and some other respiratory viruses. So I think we first need to know what we are dealing with. Only then we can actually have a protocol in place in case we reach that stage of screening and surveillance. But I think WHO as a parent body really needs to intervene and intervene now.
Okay, all right. Dr. Bagai, thank you for joining us this morning to bring us so much context on this story. Okay, let's go back to my colleague Shireen, who remains with us. Shireen, the key the key problem that Dr. Bagai was highlighting, if I were to really summarize it into one line, was just the issue of a black wall of sorts, a black box of sorts rather, around China and information around cases like this. Now, Dr. Bagai is obviously pushing for the World Health Organization to put more pressure on China. But I just want to ask you, Shireen, and this is something we were talking to Dr. Bagai too, in a case where, like for example in COVID, where you had the WHO applying pressure, but it didn't entirely work, what more can India do, diplomatically speaking?
Well, as far as the WHO is concerned, we have seen how time and again they have not been able to put any sort of strict restrictions on China or to pressurize them as far as the COVID was concerned. We have, even now in this case, with so many hundreds of cases of pneumonia, WHO has merely just asked a report on what is really happening on ground. And China is very much well known for keeping everything a secret, keeping everything a mystery. And eventually it becomes a problem for the neighboring countries like India. Now, given the fact that such cases of pneumonia are happening in China, of course, it is a concerning situation. The medical community in India, the health ministry, of course, are going to closely monitor the situation. Whether there will be any sort of restrictions on the travel, the border crossing, all these, of course, will be dependent on whether these are serious cases, whether this could actually affect the population in India. All that depends on this. So, of course, we have to wait and watch for whether the health ministry will be taking any step to come up with restrictions as far as people going to or coming from China is concerned. But at the moment, WHO has asked for a report. We have to see whether the report will be shared, and accordingly, the steps will be taken by the neighboring countries.
Shireen, can I ask you to stay with us for a second? Okay, I want to walk you through now the guidelines that are being suggested, but it is important to point out these guidelines are largely similar to the guidelines we saw during COVID, the first stage guidelines we saw. So number one, keep distance from people who are ill. Number two, reduce the risk of respiratory illness. Number three, staying at home when ill. This is a rather obvious one. Number four, as you can see, getting tested and taking medical care as and when you need it, and wearing masks where it is appropriate. Also, regular hand washing. This is another sign, this is another thing, a step that we were told to do during COVID too. Okay, we're going to move on from this story. My colleague Shireen and Dr. Sanjeev Bagai, thank you both for joining us and bringing us context.